Hello everyone, I am Professor Sumit Sinha, Brain and Spine Surgeon at Paras Hospital, Gurugram. Here at Paras Hospitals, I am seeing daily lots and lots of patients with spinal problems. And most of these patients are ranging from young age, as little as 15 years to 20 years, to as high as 80 years or 90 years. These spine problems are very common problems which happen in the patients, and most of these spine problems are because of the lifestyle of the patient. So when we talk about the lifestyle, there are certain things which we have to keep in mind in order to avoid problems happening in the spine. For example, in the young population, because of the long sitting hours on the laptop or the desktop, in the office or while working at home, there is serious problem of sprain or the pain in the back, which can be in the cervical region or the neck region, or maybe in the lower spine, which commonly patient complains of pain in the neck or the pain in the back, and sometimes this pain radiates or migrates to the upper hands, upper limbs, or the legs or the lower limbs. So this is in common terms called as sciatica, and this happens when one of the disc slips out from its normal place, and while doing so it presses on the nerves of the hands or the legs. So in the last 3 to 4 years, we have particularly seen an increase in the incidence of sciatica, most commonly of the lower back region. Why? Because people they have started working at home, sitting on the laptop, sedentary lifestyle, and absence of doing any physical activity, including exercises, or on the other extreme, especially in the younger population, doing heavy gymming, heavy weightlifting, and things like that. So the lifestyle has to be accordingly changed, and in order to avoid these spine problems. Now let us have a look as to what are the symptoms of these spine problems. The symptoms of these spine problems are most commonly the pain in the back or the neck, as I told, and this pain sometimes migrates to the legs or the upper limbs, whatever the case may be. Now there are certain other spinal problems also which can be due to the presence of the tumor in the spine, and when such a thing is present, the patient complains of pain in the back, and pain in the back is a most common symptom of most of these spinal problems. Hence, pain in the back should not be taken very lightly, and whenever you find any pain in the back troubling you, please consult your spine surgeon or a neurosurgeon who is responsible for taking care of your back, so that appropriate steps can be taken in order to diagnose that and finally treat that thing. Now, when I talk about the treatment of these problems, not all the problems are amenable, or not all the problems can be treated by surgery. Most of these problems, they require a medical treatment, which is a conservative treatment with medicines which are pain relieving medicines, and bed rest, and avoidance of those activities which I told just now, which aggravate the spine pain. So for these patients who are suffering from spinal problems, Paras Hospitals Gurugram has started spine OPDs, which will be running every Saturday from 3:30 to 5:30 p.m. So please do come, and I, Dr. Sumit Sinha, will be there to look after these problems and diagnose these problems, and treating them whatsoever possible way. Thank you so much.
Paras Health, partners in health.